Welcome back, warriors. Kwe Tansei Sego. Hi, my name is Pam Palmater, and welcome to my YouTube channel where we focus on educating the resistance and inspiring the next generation of warriors to help us save our peoples and the planet. Over the last few weeks, we have seen COVID-19 spread throughout Turtle Island, north and south of the border that splits our territories. Initially, there were very few confirmed cases in Indian country, but that's starting to change. To make matters worse, there have been inconsistent and sometimes delayed responses to the pandemic by both US and Canadian governments, both of which may result in higher risks to First Nations and tribal nations. So stay tuned to hear our most recent update. COVID-19 pandemic has had a significant impact on our sovereign native nations. While initially there were very few confirmed cases of COVID-19 in First Nations in Canada or tribal nations in the US, that's starting to change. Targeted pandemic measures are urgently needed for Native peoples who we know throughout Canada and the US's history of genocidal policies against Native peoples have created crisis-level conditions of poverty in many of our nations. ABC News recently reported that New Mexico Governor Grisham shared her concerns with President Trump that the higher rates of infection, hospitalization, and need of ventilators could literally wipe out certain tribes. And she's called for urgent targeted action. And this is not an overreaction. The Navajo Nation has been one of the hardest hit to date. They had originally declared a state of emergency and directed their citizens to stay home and also asked tourists and visitors not to go through the area. The most recent COVID-19 numbers in the Navajo Nation include 148 cases and 5 deaths. As a result, the Navajo Nation leadership has implemented a curfew in an attempt to stop the spread of the virus. Given these high rates of infection, the Arizona National Guard has now set up a field hospital and sent medical advisors to the Navajo Nation and is prepared to set up even more hospitals if needed. Here in Canada, there are 3 confirmed cases in 6 nations, the largest First Nation in Canada. As a result, they have implemented controlled checkpoints in and out of their reserve and have asked their citizens to take all known health measures, including physical distancing. The Mohawk Council of Kahnawake has reported 5 confirmed cases and have also implemented measures to try to prevent the spread of the virus, including closing all stores except for food and medicine. Federal and provincial responses in Canada have varied widely. Take, for example, the Algonquins of Barrier Lake in Quebec, who were reporting that there were not adequate preventative measures being taken to help their community to help prevent, test for, and treat the virus should it hit their community. As a result of their really strong advocacy, the Algonquins now have a testing station set up and additional health services. The situation in Manitoba has proven to be quite the opposite. Doctors in Manitoba have literally been pulled out of 19 First Nations, a decision that was made without consulting the impacted First Nations or having a discussion about what this could mean should there be an outbreak in their communities. Other First Nations in Manitoba have reported that their orders for medical supplies are being redirected elsewhere. There have also been conflicting messages from government officials for Canadians versus the messages for First Nations. On the one hand, Prime Minister Trudeau is pleading with Canadians to stay at home, practice physical distancing, and no gathering. Meanwhile, the Department of Indigenous Services, what used to be known as Indian Affairs, was literally pressuring First Nations to hold elections despite the increased risk of infections for large gatherings. It was only through public critique and First Nation advocacy that the federal government finally backed off. In both countries, First Nations and tribal nations have higher rates of pre-existing health conditions and chronic diseases that would make them especially especially vulnerable to serious complications or death if infected with COVID-19. Gunnesatake Grand Chief Simon explains that more than 50% of his community is health compromised. Much like the Navajo Nation, First Nations and tribal nations often have multiple generations of families living in one house. We know from past outbreaks, epidemics, and pandemics that Native peoples are always the hardest hit. They have higher rates of infection, hospitalizations, critical care, and death. The H1N1 pandemic of 2009 had a devastating impact on Native peoples in both countries. Despite being only 4% of the Canadian population, Indigenous peoples made up 28% of all hospital admissions and 18% of H1N1 deaths in the first wave. In places like Winnipeg, Manitoba, 55% of the admissions to the Children's Hospital were Indigenous children. And in all of these statistics, First Nations were the majority. The mortality rates for Native Americans during H1N1 were more than 4 times higher than all other racial and ethnic groups combined. Years of research also tell us that even within our Native nations, there are groups which are particularly vulnerable, including our children who have been apprehended into foster care and group homes, Native men, women, and youth in prisons and youth correctional facilities, Native women and girls who may be living in domestic abuse or rape crisis shelters, the many thousands of Native people who are homeless and may be living on the streets and in shelters. All of these places are overcrowded, unsanitary, and facilitate rapid spread of infections. In every one of these situations, Native peoples are grossly overrepresented and thus require urgent, targeted pandemic funding and interventions right now. Recently, the United States approved a pandemic relief budget that included $10 billion for tribal nations and programs that support tribal nations. In Canada, the federal government announced an incredibly small amount of $215 million from the more than 634 First Nations. That is not to say that the U.S. is the savior here. The U.S. amount is only about half of what some tribal leaders and representatives had actually costed out and requested. But the Canadian amount isn't even enough to provide adequate services and prevention measures to the remote First Nations, let alone the majority of First Nations, or even 50% of our population that lives off reserve. It was quite a relief to hear that the National Guard had already started to set up emergency medical stations in partnership with the Navajo Nation and are prepared to do more. Hopefully, this will be the response wherever it is needed all over Indian country. Here in Canada, more than 24,000 troops have been activated to help fight the virus, but none have responded specifically to the request by First Nations in Manitoba to set up military hospitals. A wait-and-see approach is simply the wrong approach in dealing with pandemics. Prevention and preparation is the key to saving lives, especially in Native nations where our people are much more vulnerable. Governments can't simply remove doctors from our nations and then deny requests for alternative measures like field hospitals, for example. That puts our lives at serious risk at a time when COVID-19 numbers continue to climb. The United States has become the epicenter of the pandemic, with the Centers for Disease Control reporting more than 163,000 cases and more than 2,800 deaths so far. While Canada's numbers are far lower at 7,700 cases and 89 deaths, many people have been reporting that they're not being able to access any of the testing to know if they have COVID-19 or not. In both countries, the greatest concern are vulnerable populations, and all levels of government, federal, provincial, state, municipal, and Native governments must work together to prevent the spread in Native communities, knowing that the impacts will be disproportionately higher. Even the various United Nations human rights treaty bodies, agencies, and experts have called on various states to work with Indigenous governments and provide priority targeted pandemic measures. I am encouraged by the many ways in which tribal nations and First Nations have acted early to prevent the spread of the virus amongst our peoples. More and more are exercising their sovereign powers to close their borders to their territories and keep out tourists and visitors to prevent the spread of the infection. For those nations with their own source revenue, some of them have been able to take extra measures to provide basic income and supplies for their citizens, while many other nations rely on our collective advocacy to push governments to do more. After all, it's important to remember that all of the funding allocated for these pandemic measures comes directly from the wealth that's generated from our lands and resources. Thank you all for your continued advocacy to protect our native nations all over Turtle Island. What I will do is post the articles that I have been publishing on COVID-19 issues that are specific to our nations, all of which contain some priority action items that could be taken by governments right now. I'll continue to post these articles as they're published. In my next video, I'll be addressing the darker side of this pandemic, some of the most insidious legal, policy, and economic measures that are being taken by American and Canadian governments that may negatively impact our treaty, land, and other rights. Developments in the Wet'suwet'en Nation in Canada and the Mashpee Wampanoag tribe in the United States are a few that we'll cover in the next video, so be sure to subscribe so that you're notified when it's posted. Thank you for watching my channel. If this is your first time here, please consider subscribing, commenting, and sharing these videos with your family, friends, colleagues, and social justice allies. If you want additional resources, you can check out my website at www.pampalmater.com. I'm truly hoping that you're all healthy, safe, and sheltered during this pandemic. Till next time, stay alert, warriors. We need you strong, healthy, and ready to defend our territories. Walalyag.